Welcome to the FutureDDS Dental School Experience Series, where we help you decide which school is right for you. Every school offers a unique and very different experience, and who better to explain that experience than someone who goes to that school. Our goal is to give you a first-hand perspective of every program across the U.S. and Puerto Rico, and ultimately help you make the right decision where to spend the next 4 years of your dental school journey. So today, we'll be showcasing Macy Huddle, right? Hiddle.
Yeah, Hiddle.
Hiddle. All right, there we go. Sorry. Macy Hiddle, who is a second-year student at Midwestern University College of Dental Medicine in Illinois. How you doing today, Macy?
I'm doing good. How about yourself?
I'm doing all right. You know, just making it through this finals. But if you could, I just want to say, of course, first off, thank you for taking some time out of your schedule to sit with us and kind of give us your perspective on everything. Yeah, so if you could, I guess, give us a little bit more background about yourself, where you're from, where you went to undergrad, as well as what got you interested in dentistry.
Okay. So yeah, like you said, my name is Macy. I'm from North Central Wisconsin, and I attended UW-Madison for undergrad for 4 years, where I majored in microbiology. And then I actually stayed 2 more years and I got a master's degree in microbiology because I actually love studying micro and infectious disease, which everybody else in my class hates. And then after that, I ended up coming here. So I just went straight 3 programs in a row. I actually got interested in dentistry kind of late. So my path, I guess, is a little different. I first started out pre-pharmacy, and I was pre-pharm for a really, really long time. But then I was like, yeah, I kind of want some more patient contact, So I started looking at other stuff, and I mean everything. I was a pharmacy tech, I was a caregiver, I looked into CNA, and I actually ended up shadowing a pediatric dentist my junior year, and that was totally it. I was like, this is awesome, let's do it. So I decided kind of late my junior year. And at that point, I'm just going to be completely honest, my GPA was not bad, but it wasn't amazing. I had like a 3.4, and I knew dental school was really competitive. So from there, I actually decided to do the master's. Kind of came open as an opportunity for me, I guess. It just kind of naturally flowed as I was a tutor, and I had heard that you can do like a TA-ship and a master's or teaching assistant, and that can kind of help pay for your schooling, and you can take extra classes, and you can kind of do the dual, I guess, degree and experience. So that's kind of what I really wanted. So I went ahead with that, and then it was like, you know what, this is totally what I want to do. I want to be a dentist. And then I applied halfway through my master's degree, and now here I am.
Man, that's awesome. That's awesome. So,
yeah.
For everyone out there who may not know too much about CDMI, if you could, just give us a little background about exactly where it's located, how is that city for you, and how big is like class size, just some general information.
Right, yeah, absolutely. So Midwestern is located in the western suburbs of Chicago. So it's not in the Chicago city proper, but it's only about 40 miles away. It takes about an hour, depending on rush hour, which, if you know anything about Chicago traffic, I mean, it can take you a half hour to get to the city if you leave at 5 a.m., or it can take you an hour and a half, and you just sit there and don't move for like 20 minutes. But it's not too bad. There's tons of trains that are around, so getting to the city is super easy. Midwestern University as a whole is kind of a different program. For those of you who attend a school like UW-Madison, where they have undergrad, they have grad school, Midwestern is just like a professional campus only. So they only award master's degrees, doctoral degrees. They have a master's in biomed science. They have a pharmacy, dental school, all of that. Which personally I actually really like. It's really cool to be around a bunch of other students who are at like a graduate level and are studying all the time, and everybody's very focused, and it's awesome. So yeah, we're located in Downers Grove in the western suburbs, and that's the patient population we serve. And our class size is 130, which I actually think is a great size. I think it's perfect. Yeah.
That's smooth. 130. Okay. That's awesome. All right. So I guess what were some key things that you were looking at when you were actually deciding what school to go to, when you're making a short list of schools to apply to, and then ultimately, I guess, what led to your decision to go to CDMI?
Right, yeah. So my biggest thing, I guess, that I kind of landed on, and I kind of learned this lesson while in my master's program, was that finding somewhere that's a really good fit for you is number one. So when I applied to schools, I only applied to ones that I felt like I would be a really good fit at. I felt like I would love living in the area. I've met students from there, or I've talked to them, or I've heard really good things about the school. And it was like, okay, I feel like I can jive with the personality that school has.
Yeah.
So I only ended up applying to like 5 or 7 schools initially. Midwestern, though, why I chose it, and actually it was, of course, in my top school since I only applied to a couple, but I was blown away at the interview because the campus is incredible. It is beautiful. All of the technology, all the facilities are up to date, and they have everything. They have all the bells and whistles and more.
Wow.
I mean, the technology is unbelievable. The brand new CAD/CAM machine, they have lasers, they have implants, they have all this stuff up to date. Everything's brand new. They've got, these contracts with these programs. It was awesome. So that really stood out to me. I felt like the other schools I had toured and interviewed at, I didn't really see that as prevalent, just personally from my experience. But honestly, one of the biggest things to me, and one of the things that I found most important, like I kind of mentioned already, was fit. I felt like the student-student relationship and the student-faculty relationship was unlike anything I had seen anywhere else. And when we were walking around the interview, our interviewers were really open and honest and fun. And then we were walking around clinic, and we're walking through suites where there's patients, and we see faculty and students joking around with the patients, and everybody's like across the suite, like, hey man, how's it going? It was just this really awesome, like comfortable vibe. And that really sold me, because you can learn, personally, I think you can learn dentistry at any dental school. Any dental school is certified and amazing, but I felt like I have a personality like that, and I felt like I would really fit in well, and I would have a really good experience here. So those two for sure. And then lastly, I was really attracted to Chicagoland. Chicagoland, as you know, is a huge dental hub. The ADA is centered in Chicago. They've got a huge DEA chapter there. And I noticed that our school had really, really tight connections with those organized dentistry chapters in the area. Like every class has a couple of representatives that go to these local chapter meetings and discuss with dentists. Wow. And so I thought that was really valuable for like beginning to market yourself and make connections as a dental student. So yeah, that's why I chose Midwestern. Yeah.
And man, it seems like a perfect fit for you.
It does. I'm really happy
about it. That's dope. That's awesome. So I guess if you alluded to it earlier, but we could go back, flashback to your actual interview process. How was that day for you, actually showing up to the campus or the facilities, and actually like walk us through that day for you? How was it for you?
Yeah. So it actually flowed really, really well, which, an interview day, you're kind of really nervous. Just starting off, because it's in such a highly populated area, I mean, finding a place to stay, and the school offers like a student discount. So that was awesome. Just right off the bat, that was easy. Coming into campus, because they've got a private parking garage. So you can drive to school every day. You always have parking. I'm from UW-Madison, where there's no parking ever. You ride your bike or you take the bus. So it was really cool to be able to like have my car with me and park, and there's no tickets, there's no nothing. You just have a sticker on your window, go. When I went into the interview, right away we got to talk with the dean, which I thought was awesome. Some places I checked out, you didn't really get to see the dean too much, but he was right there, and he was asking questions and answering questions. And then the day, my interview style, it's changed a little bit now. We had MMI styled interviews, but they've recently changed it to more a personal one-on-one interview, which I like more. And actually I run the interview process on our campus right now, because I'm on student council. So I actually schedule the students that interview that day, and then I associate them with the faculty so they can go over the new candidate interviews. So if you have any questions about that, I'd love to answer that for anybody, or if anyone wants to reach out to me, absolutely. But like I said, it was just really casual. They took you on a tour of the campus, all the basic stuff in the clinic, and what really stood out to me was that student faculty and student relationship. And also just the faculty in general were all really awesome. Everybody had a great sense of humor. Everybody was, but very professional at the same time. And I was just blown away by the people I'd met. And for me, it was it. It was just really easy day, and it was not what I expected. And I was surprised, and that was it for me. I was like, I gotta go here. So.
Man, that's awesome. That's awesome. So, now we've got through the interview process. We actually, get the acceptance letter. You're excited. You're super excited to officially be on campus. how was it those first few months, actually transitioning into school? You did your master's, so maybe the transition was a little bit easier. But so I guess, how could you walk us through kind of how they got you oriented through orientation and, actually easing you into classes?
Yeah, so man, it feels like a long time ago.
Yeah, right.
Not the second years, but it's like, ooh, it's a long time ago. I mean, I'm gonna be completely honest. The transition was not as rough as I was expected, but I feel like for anybody, it's gonna be tough. I mean, it's just a different beast from what you're used to, whether you have a master's degree or not.
Yeah.
Orientation for us was 2 full days. They give everybody a brand new laptop. They take you through everything. They say, here's your bench. They show you all the ins and out, which I'm sure is the same at any dental school we're at. But I felt like once classes had actually started, I mean, I'm going to be honest, the first 2 weeks I was really, really tired because it was, you're used to having your free time. You're used to being able to I'm going to skip class today and go get coffee instead. You know what I mean? Yeah. And then dental school is very scheduled. They have, at least for us, a lot of our classes are mandatory. A lot of our dental classes, we only have a certain number of absences per quarter, so you don't want to miss. And if you miss a lot of material. So I thought the first 2 weeks were tiring. But having said that, I feel like the CDMI, which I don't know if I ever clarified actually, but Midwestern, we're also known as the College of Dental Medicine, Illinois. So if I say CDMI, that's what I'm talking about. We just call ourselves CDMI. We rarely call ourselves Midwestern. It's just, I don't know. Pharmacy school is CCP, Chicago College of Pharmacy. It's just a thing. I don't know. Anyway, I felt like CDMI did a really good job at kind of gradually bringing us into the workload. Like each quarter progressively gets a little harder and you get a little more work thrown at you. But overall, I felt like the adjustment wasn't too bad. And I think a lot of that, like I said, again, has to do with the staff. They are very passionate about what they do. They are always willing to come and help you. Like I always love telling people this, but one of my sim clinic professors, he will send an offer out to anybody. He's like, if you want to practice, I will come in Saturday morning, 6 o'clock in the morning. I will stay here with you until 9 a.m. 9 a.m. is when my kids wake up. So I have to go home. Right. So I have to go home. But he's like, you want me here? I'll be here 6 a.m. Let's do it. Yeah. And we've had other professors too, like our endo professors offered to come in on weekends and help out with boards practice, So I think that really helps when you're adjusting to the workload to have people like that are willing to help you.
Man, that's awesome. That's awesome. Seems like they do a good job with that. So, I guess, how does a typical day look for a first year there? You said a lot of classes are mandatory. They kind of walk you through your bench and everything. But how is it set up? Maybe, I guess, walking through like a quick run through of like a week, like Monday, Tuesday, Wednesday, classes versus lab, that type of deal.
Right. So again, I'm going to be honest with you. My first year experience might be a little different from somebody who's coming in simply because, and I don't know if a lot of students know this, but we actually have had a change in administration. So they're switching around a couple of the things with the program. But honestly, I don't expect it would change this much. So I'll tell you what I think it'll be and what I had. And
got you.
It's probably pretty close. But first year, so they spend most of their time studying basic science. So Monday, Wednesday, Friday are dedicated to basic science courses. So their start class probably about 8 a.m. and they'll end around 3 p.m. And each lecture is broken into 50 minutes. How our basic science is currently scheduled, and I don't believe this will change, but it might. Sorry to have the gray area, but I just don't know. Our basic sciences are integrated, which actually I absolutely love at this school. So we don't have a class that's histology and a class that's basic biology. Everything is integrated. So we'll have a class on cardiology, and they'll go over the histology of the heart, the anatomy of the heart, the physiology of the heart. They'll go through everything that is the heart and cardiovascular system, and that's your class. It lasts about 2 to 3 weeks, and then you do the next class. So they'll do like kind of one class at a time, and then you'll just get lectures, 8 hours of lecture on that class, Monday through Friday. But it's nice because everything's compartmentalized. You're not trying to pull from different subjects and relate. They relate it for you. So that's first year, basic science. On Tuesdays and Thursdays, you have your dental class and your sim. So we also have our dental class all integrated. We don't have like a separate class on occlusion, a separate class on whatever. It's all integrated into one. So in the mornings, you have 2 hours of lecture, 7:30 to 9:30. And then you go to sim clinic, and you're in sim clinic like 9:30 to 11:30, and then 12:30 till about 4. And then you work on projects with faculty. So your Tuesdays, Thursdays are dental, and then you have 3 days a week that are basic science. I'm not sure if they're going to be completely honest, I'm not sure if they're going to change that at all. I don't think so, because it's so highly loved by the students, and we've got a very high boards pass rate. So clearly it's working, you know? But that's kind of how first year is. And I think it's a really nice way of getting the basic science out of the way, but also starting to introduce dental in there. So you're kind of beginning to build hand skills slowly, and you can get used to it. Unfortunately, first quarter is dedicated to wax up. So you guys are going to start, you're going to start working with your hands and making fake tooth out of wax. But, you know, I think it's a necessity, and I think it's really great practice. So yeah, that's kind of the life of the first year.
Got you. So, you know, that seems like it could be a very hectic schedule, especially for somebody just jumping into the dental school grind. How do you feel like, you know, you handle work-life balance yourself? And then is there anything that they do, you know, whether it's events through organizations or maybe just like an extra day of a lighter class or something like that? Is there any way that they kind of work it in to help you with your work-life balance through the school?
Yeah, absolutely. So schedule wise, I think for pretty much all of first year and most of second year, you know, there will be some days where, you know, you're not in class all day. You'll have like an exam, and they'll give you the morning off, and the exam's at 11, or they'll give you an exam at 7, and then you don't have class till noon. So they do build in some time, you know, to have off, which is really, really nice. Personally, so I guess I don't know if I'm a good person or bad person to ask about this. I'm kind of crazy. I like to be involved in a lot of different stuff. I'm on class council. I'm on class senate, excuse me. Well, campus senate, I guess. I'm going to be president of the AAWD starting in like 2 weeks. You know, so I'm involved in stuff. I like to, you know, participate in stuff. Personally, I think that helps me have a better balance, because, and I'm sure you can attest this too, the material in dental school is endless. You can study every hour of every day and still just feel like you need to look at more stuff. I mean, that's just kind of how it is. But I feel like being involved with things is really good, because you learn things that you don't learn in class. You know, in dental school, they always teach you the basics, because there's so much to dentistry. They can't teach you every little detail. So I think getting involved with clubs, you can start to look at other things. And I also think that it kind of budgets time away from school, that, you know, you get to do something you enjoy. And so personally, that kind of helps me with the balance a little bit. It pulls me away from studying and gets me doing other things. So there's that. And also I like to work out, and I like to do, you know, I have like HIIT classes that I go to at a gym, and I like to go see my friends in Wisconsin sometimes. And I'm going to be honest, first year I was really horrible with that. I studied all the time. I was like, I have to study all the time. Oh my gosh, you know, I can't take a break. And then, you know, as second year started, I was like, okay, put a set time in your schedule ahead of the week. I have to work out Tuesday night from 4:30 to 6:30, or I'm going to see my friend Saturday afternoon for her wedding shower. And I think if you budget your time in really, really well, you're going to be better off at that balance, because you have to do this at this time. You have to take time for yourself. So you're going to be more productive with your studying, and then you'll get your time in that you want. So I think organization and time management is really, really big in this realm. Okay. By the way, I always give long-winded responses. I am so sorry. I love to talk, obviously, but yeah, so that's what I do. I know that campus has a lot of stuff, by the way. Other classmates of mine do that. Intramural sports, they always talk about how they love to like beat the D1s or like beat the pharmacy students in basketball. Like the guys talk about all the time in sim. Like, did you see that pharmacy student dunk the ball? Like, are you kidding me? Like, you know, they talk about that all the time, which is fun. Personally, I just do all my stuff off campus, because I feel like I'm so busy on campus all the time anyway. But there's tons of stuff on campus or off campus in Chicagoland. I mean, it's endless. So just budget your time well, and you'll have time for yourself.
There we go. So say I'm a pre-dental student, you know, I'm definitely looking at CDMI. It's on my list. What are some things that I should be doing right now to help prepare myself to get in and be successful once I do get in?
You know, honestly, I think kind of like I said before, I think organization and time management is the biggest thing. Because like I kind of said this too already. We both know in undergrad, you could be like, I'm going to skip class and have coffee with my friend, or like, oh shoot, I have a test today. I'm just going to like study this afternoon and, you know, cram it out. I think in dental school, it's really, really hard to do that because again, it's a different beast. Like you're used to having a class that's 3 credits, 3 days a week. One of my classes this quarter is 10.5 credits. So it's different. You can't cram things last minute. You can't expect to skip half a day of school or whatever to get that in. You have to do it little by little. And I think if students are looking at CDMI or even dental school in general, I think it's really smart to start practicing organizing your schedule and looking at things little by little every day and making sure you always book in time for yourself and time for sleep. You know, getting yourself in that routine. And I think if you can nail that, you're going to start dental school like hot out the gate because you already have that part down. And that's one of the hardest things to get figured out is like, how do I balance all these different things? So.
Okay, so, you know, a lot of people, when they think about dental school, they don't necessarily think about the research aspect, but they think more about being a clinician aspect of dental school. So, you know, how did they kind of progress you into clinic and through clinic? Like, do you guys start pretty much like assistant first year and then second year just like ramps up a little bit more and more until you're solely in clinic like third and fourth year? How is that?
Yeah, so I think, and again, this might change a little bit with the administration, but I think my school did a really good job of introducing us to clinic. So first year, first quarter was honestly baby steps. They had us coming into clinic right away, but they were doing very basic things like, first off, before you're going to assist or do anything, how do you set up the operatory? Do you know what PPE is? Do you know what infection control is? And they would actually have us come in and they'd make us set up and break down spaces. Like, do you know how to do this? You know, and then they started introducing the electronic health record. Like, how do you enter patient information? How do you take notes? You never paraphrase. You always quote what the patient tells you to make sure you're always getting exactly what they say and what they want. So that was kind of like first and second quarter, first year. And by the way, we're on a quarter system, so we do 10 weeks. There's fall, winter, summer, spring. We go all year round, including summer. But probably about like winter to spring, then we started like actually going in and assisting. And we would go in and assist on our rotations, which were always on Fridays. Friday day is rotation day. So that's when you started assisting, and you're going to get a lot of assisting experience. I mean, I've done it so many times, I don't even know. So then it kind of rolls into that. And then by the time you hit second year, you're assisting a lot. And then you're also doing hygiene. So like just 2 weeks ago, I replaced the hygienist at our clinic, and I took patients in the afternoon on Friday, and I cleaned their teeth and was talking to them, and it was really fun. Yeah. So I think it was a good way of kind of integrating you into the schedule, because not every student was an assistant. Not every student's going to feel super comfortable talking to patients right away. So by just giving them, you know, the role of, okay, ask the patient questions, fill out their med history on Axiom, you know, you start to get a little more comfortable. And I've never been uncomfortable talking to people. Obviously, I like to talk a lot. But like, even then, you know, you see that for a patient, you get a little nervous. So I think it was a really good segue. I definitely feel like I've had plenty of experience, so I don't feel like they started me too late or anything. One other thing I think is cool with clinical experience is, like I said, Fridays are rotation days. On Fridays, we don't have any other class or sim. It's purely rotations. So, and that depends on your group and your weekly schedule. This last week for me, it was endo. I did molar endo Friday. It could be CAD/CAM, it could be radiology, it can be hygiene, or just clinical assisting rotations. Oh my gosh, there's so many of them. I can't even list them all off. But, and we do them in pre-clinic and clinic. So I think it's a really good way of getting you used to then in June, when I begin my third year, I will be 100% in clinic all the time. So I'm so ready. I'm ready to go.
Yeah, I know, it's right around the corner.
I feel like my hand skills are good. I feel like my communication skills, the patients are good. I'm like, I'm ready to go. Let's do it. I'm excited.
So we're going to, get to the end now, start wrapping it up. But I just want you to, one, just give any last nugget of, what you feel is extremely unique about your experience at CDMI. What do you feel like is a major advantage of your school? It could be something that you mentioned before that you want to reiterate, or something new. And then also, for our viewers, any last words of advice, maybe if they aren't necessarily looking at CDMI, but, just anything that you would like to give as like a words of wisdom to anyone applying or looking at dentistry.
Right, absolutely. So about the school, I kind of covered like, the faculty-student relationship and the technology. Another thing that I really want to highlight, because I think it's amazing, is actually, and I guess I can't say this for certain, but I am quite certain that the 2 Midwestern campuses are the only campuses in the country that include laser certification in our curriculum. I just took my test and passed to be laser certified.
Awesome.
So I passed like the pre part. Now, when I go to clinic, we're actually going to be doing procedures with lasers. We're going to be doing endo with lasers and tissue removal. And that's like a huge new step in dentistry. So when I say the technology is there, I mean like it's there and it's awesome. Yeah. Like the work you can do with lasers is unbelievable. And
that's cool.
It's cool, yeah. So, the faculty relationship, technology, being in Chicago, all those things are great. And I think all those things make our school different. And I feel like I am in my best place. Like I couldn't imagine myself anywhere else. So if anyone's considering CDMI or even thinking about it, definitely take a look at it. Go interview, see if you get that same vibe and experience. Because, what's right for me might not be right for you. But I think people should look into it and consider it because it's a great program. Kind of going off of that, then any last advice I have for someone applying, like I know it kind of sucks, I get it, it's so stressful. 2 things that I guess that I kind of learned is, first off, never give up. Because like I said, I thought my GPA in undergrad wasn't amazing. I had like a 3.4, and I mean I'll give you numbers because I'm very open and honest and I'm not afraid of anything. So I took a master's and I worked really, really hard and I TA'd and I learned, what's on a test, like it kind of, how do you study? How do you teach? How do you become a professional? And my GPA boosted. I ended up getting like a 3.8 in my master's. It was awesome. So it's like, I never ever would have thought that I could have ever done that in undergrad, but I didn't give up. So if anybody's in that position, don't give up. There's other avenues, there's other tools. You can get a great GPA. It might take a little time and that's okay. It doesn't come to everybody naturally right away. It did not come to me naturally right away. Right. And then I ended up coming to dental school and I'm doing very well. I've got a very good class rank and I'm really proud of that, So like, don't give up. There's always that possibility of succeeding. You just have to have that in your mindset that I can do it. So that's the biggest thing I think that I would like to say. Another thing is don't stress and just be yourself. Like I said, there's tons of programs. They're all great. Everything's got a different fit. And I think when you walk into the interview, you should have the mindset of they're interviewing me, but I'm also interviewing them. Don't be afraid to ask tough questions. Like I asked one of the deans and I was kind of sweating when I did it. I was like, I heard this about this school. I heard you didn't get clinical experience. I heard students didn't feel ready going. What do you have to say about that? And honestly, he looked at me and he was like, that's an excellent question. I'm glad you brought that up. Like they respect that because it shows that you're really considering that. Yep. And, through your interview day, look at how they respond to you. Look at how they talk to you. Look at the vibe of the place. And you should really feel like you're at home because it's a tough 4 years and it's a big part of your life. And you should feel really comfortable and really happy with your decision. So just be yourself and you're going to get interviews and you're going to get accepted at places that they look at you and they're like, this is the person we want here. This is our class. I'm sure you can attest to that. You look at your class at Tufts and you feel like you belong. You feel like you're all similar and very diverse and different, but all similar. So that's my 2 really big pieces of advice for people.
Yeah, it's like a big family.
It really is. You go through so much together. You kind of have to be, and everybody's so different. Like my class is so diverse. It's like unreal, but we're all, connected and it's awesome.
Yep. Well, Macy, again, we don't want to take too much of your time, but thank you. You did a great job today, giving people a great perspective of what CDMI has to offer.
Yeah. Thank you. And if anybody has any other questions, I gave you, I've got an Instagram page at Macy Lee DMD. So go ahead, follow me, message me, ask me questions. Absolutely. I will talk to you because I get it. It's stressful, but yeah.
Awesome. Thank you again. You guys definitely check out her Instagram. If you have any questions for Macy about dentistry, about her journey, about CDMI, anything, hit her up. We'll put the name down in the description so you can get to that easily. But other than that, again, we want to just say thank you for taking some time out, sitting with us, giving us this great perspective on CDMI and insight into your school experience so far. Best of luck to you going forward. Heading in the clinic officially. I know you can't wait.
We're almost there.
almost there. But yeah, so everyone, all the viewers out there, definitely, if you haven't already, hit that like button, the subscribe button, and the notification bell so you know whenever we post some new content. And again, we're going through all the schools, all 66 schools. So, I'm sure you'll find a good school, a perfect fit for you. And, this series is here to give you that perspective to help you with your decision. So, if you haven't already, again, hit that like button, the subscribe button, and the notification bell. That's going to be it. Thanks again, Macy. See you guys later.
Thank you.